Yeah, like I said, the primary foundational aspects of recovery are irrelevance and permission giving.
Right. Right. Okay. So very interesting stuff there. Thank you for that. The next thing I wanted to talk about, and you kind of alluded to it already, um, somewhat, and we'll get to that in a second. But
Something just occurred to me. We're
please.
talking about very important concepts, um, and very very high level therapeutic psychological principles. We're discussing that. Some people who are listening might have some aha moments and think that, oh wow, I've just discovered why I'm so resentful of my brain, or why I've been so desperate or fragile. These things are very critical in the perpetuation of the condition: resentment, fragility, desperation. They're huge sort of you know uh, problems. They contribute to the disorder's duration. But no matter how beautiful the principles you and I are discussing are, the goal of the therapy is really a starvation paradigm. I always analogize treating OCD as like starving a bear in your backyard.
Mm.
There's this bear, it's menacing, it's throwing around your patio furniture. You gotta, keep the dog inside. So you don't like that bear's in the backyard, and you decide to build a fence in your backyard, and you decide that the way you're going to get rid of the bear is to starve it. So day one, we haven't fed the bear. The bear hasn't eaten. But I tell you what, that bear can still rip you to shreds, and that bear can still make lots of noise and still throw around a lot of furniture. So the idea is that no matter how amazing these concepts are, and no matter how much depth one has in these principles and understanding them, it doesn't mean diddly squat,
Mm.
because until you starve the bear, you're going to be challenged. You're going to be made aware in an unpleasant way that OCD is still part of your life and the bear is still in your backyard. And so, really, people are so inclined to look for the finish line where they can say, aha, I no longer have OCD. I get to give back my trophy for being an OCD patient. And that focus on the finish line is, once again, antithetical to recovery.
I love that.
I can know after 3 days that I haven't fed the bear, that bear is starving, but that even after 3 days, that bear is still strong and has a lot of power and can be very disruptive. But I have to celebrate that I've gone 3 days and I haven't reinforced the bear. And that's my trophy. And so rather than saying, oh, look, I still have OCD, that's horrible, how long until the bear is dead?
Mm-hmm.
You have to just know, oh, look, another day, day 4, I haven't fed the bear, I get another victory. And if you don't look at it that way, then you will probably lose the struggle with OCD, because you're focusing on, once again, trying to control it. And I don't blame people for that. It's within our instinct, because OCD is so disruptive and it's so compelling. OCD screams, you need to get rid of me. Your life is in danger. You need to seek relief. It's the entire foundation of our existence as an organism, is survival. And OCD's signal emotionally says, your survival is in danger. You need to fix this. So to be negligent, to allow yourself to not try to fix the problem, is against our entire programming as a species. And yet we're capable of it. It's just incredibly difficult.
God, I love the way you said that. I love the way you said that, Doc. The desire to get rid of it, the desire to be free of it, the desire to finally breathe and exhale and say, I don't have to deal with this crap anymore, is in effect reinforcing it. That's the paradox. You're adding you're giving it weight, but you're this boulder in my life. I can't achieve what I want to achieve. I can't have a family. I can't pursue my ambitions with this boulder here. You're giving the boulder, AKA, and again, that's almost a pejorative, right? You're giving that boulder too much meaning, right, Doc?
Yeah. And once again, as you're using terminology that's very common, you're looking at life in terms of a dichotomy. Like, I can't do X, I can't do Y. You know, I can't focus. I hear patients say all the time, I can't focus.
Yeah.
And that's a lie. During one of my worst panic attacks of my career, I had, unfortunately, with a patient about 20 years ago, I had some DPDR, depersonalization, derealization, and I was I was an emotional mess. And here I am in front of a patient who is yammering on about how she's frustrated with her fiance. And I sat there and I literally heard 5% of what this young woman said. And I just sat there and I tried to shake my head yes, as if I was following her at opportune moments to make it seem like I was paying attention. And in my head, I was debating, because I thought I was having a psychotic break, I was debating to ask her to leave because having a psychotic break in front of a patient wouldn't be so fair, versus seeing it as an anxiety reaction, which means don't terminate the treatment, don't terminate the session. And so for the first 15 minutes, I was trying to figure out, am I going crazy or am I just having a panic attack? That desperate attempt at getting an answer fueled the anxiety, and that's probably why it lasted the entire session. But even with this horrible emotional storm, I was able to hear 5% of what she said. I was able to shake my head yes periodically. And the funny thing is, because I'm usually a very talkative shrink in the session, she probably looked at it like she had the best session of her career, because Phillipson finally shut up. She was able to get, usually don't take her ideas off her chest. So I don't think she had any clue that I was going through a tremendous panic attack. She didn't even ask, "Hey, Steve, are you okay?" I've had a few patients ask when I've gone through some other challenges. And then after she left, I put my head on my desk and I cried. I was so upset that I was in such emotional pain for about 5 minutes. And I took my head off my desk. I was like, "Hey, I'm still here. It wasn't a psychotic break." And, the funny thing is, the next time she came in the following week, I had the same panic attack. But at this point, I knew exactly what it was. And I said to my brain, I know what this is. And it lasted 20 short minutes, and I didn't care. And then the following week, same person had another panic attack, and this one lasted 5 minutes. And I was just laughing at my brain. Oh, really? And I think that it wasn't her by any means. It's just I became conditioned that this was the person that I'd had such a traumatic experience with. And then after the fourth session, where I had a 1 minute panic attack with her, it never came back. And I've had other panic attacks, but not during a session, I'm happy to say. But if I had one, that would be fine.
Right.
And so that's the important caveat, that we're not celebrating the absence of anxiety. We're celebrating our faith in our ability to manage anxiety.
We're not celebrating. I love the way you said that. We're not celebrating the absence of anxiety. We're celebrating our way of managing it, our approach to it. So, correct me if I'm wrong, Doc, but what you just laid out there in each subsequent session with this patient, obviously the first one being the most intense, but the intensity got less and less more severe because you habituated, right? You communicated to the brain that it's not relevant. Am I wrong? You just I feel like in that small 5 minutes of talking, you've laid out the sort of kind of goal of this exposure, ERP, exposure response prevention. Am I incorrect, Doc?
No, you're not. because you're not a
The
psychologist.
goal being like habituation, correct, and not
Well,
adding
habituation
relevance.
takes place when we don't seek relief. So
Hmm.
you see, ERP is where we voluntarily conjure up. So if I had taken a picture of her
Oh,
and
right. Okay.
and shown my brain, oh look, this is the one I have panic attacks with, 10 times a day, that's ERP-ness.
That's ERP. I'm sorry. Yeah.
Right. That's okay. You're like I said, you're
Yeah.
not a psychologist. You're not supposed to know
No.
the nuances of these terminologies.
Yeah.
But it's called habituation. So you nailed that one, where we expose ourselves, or she showed up, and I did not engage in any relief seeking. I made room for, gave permission to have the anxiety, and the brain reacts as the machine will when we allow it to do its independent system thing, and we don't fight it.